This one person.
Yes, yes, we can always try Shivambu. It will have always a great effect. It won't
So
cause any
a
harm
diabetic
to
mother who is having
diabetic.
pancreas, is it
Yes,
curable by?
yes, 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 yes. No problem, no problem. I
Then
just like I told, yes, it can be cured, but there are a lot of conditions right now. So they should be willing. First thing first is they should have a willingness to get cured. Okay, they
that
should have a will to get cured. First thing, their mindset should be good. That yes, Shivambu is going to is going to have a good effect on me. They should have that mentality first. Second thing is their physical ability of walking or doing physical activity should be there. That is one of the most important thing right now. Okay. So I'll talk with them personally and then I'll let them know what they should do, what they should not do.
the,
Sandesh,
okay, the
can
patient could come back to you,
you
isn't it?
show slide?
Hello.
Anybody would like to ask any other questions?
Yes. Kapil here.
Yeah, please ask. Please ask.
Will you please share me the slide of healthy Shivambu?
Yes, sure, sure. You contact me personally, I'll share you.
Okay, so I want to add one point in that thing that I think it is missing. That vitamin D3 is important, but as well as synthesis of melanin. That means sleeping in the dark night is also equally important for healthy Shivambu.
Sure, for
If
sure.
if
Melatonin, again, melanin, as you told, melatonin helps you to secrete a lot of serotonin, dopamine, everything, which are happy hormones, which releases happy hormone in our body. Sleeping,
yes,
nocturnal sleep, we call it nocturnal sleep, without using any light or keeping dark shades on your windows should be used, and you should sleep in utter dark night, which will help again to release melatonin. Melatonin again is a precursor of serotonin, dopamine, which is happy hormone, which when we get happy, when we feel good, the serotonin, dopamine levels are high. So for these all hormones, you need melatonin in our body.
yes. So that's what I want to tell. That one
Yes,
point I it's
yes,
missed out.
sure, sure,
Yeah.
sure.
Hello,
Yes,
hello,
Sandesh, another question in the chat was
hello.
insomnia.
Dr. Patelji, another question. Hello. Hello.
yes,
Yes.
There are a lot of people using various medicines, especially allopathy medicines for various
mhm.
diseases. After using Shivambu, they are getting better, good feeling. They want to stop medicine. What are the procedure for stopping the medicine according to protocol? Could you please explain?
Uh, yes, yes. So there are a lot of parameters for stopping medication. First, let's come for, I'll tell some few basics which we come across daily. So there are some patients with thyroid problems. They are having thyroxine, thyronorm, where their TCH, T3, T4 are increased, decreased. So what we can do is after some time, after like 3 months or duration of 2 months, 1.5 months, what you can do is tell them to take TCH or tell them to take a thyroid report, thyroid levels, or they should get checked and they should go meet any allopathy doctor who MD medicine doctor, and he will stop the medications if the thyroid levels are normal or reduced with help of urine. Okay. So now coming to diabetes. Diabetes, as we know, within 10 days we'll get that result that diabetes is gone from our body after practicing Shivambu. Yes, we can stop that diabetes medicine because it won't affect that much in your body. If the blood sugar levels, again, if by mistake of the patient, if blood sugar levels get high, they can always take that medication. It won't affect any greater extent. Okay, so we can instantly stop the diabetic medications. Now coming to heart problem. Okay, cholesterol medications we can stop after taking a report. If their cholesterol levels are normal, LDL, HDL, everything is normal, we can stop. But coming to hypertension medication, which they take for high blood pressure, we cannot stop that medication because it creates a habit to our body. It's not a medication, it's a habit to our body, it's a habit to our arteries and veins to dilate, to keep it dilated, so that blood pressure is always low. Okay, so we should never try to reduce, or we should try to stop the BP medication if the patient is taking medication for more than 5 years. Okay, so this is one condition. I have learned right now with the experience. So you should never stop any hypotension or hypertension medications. Rest of the things, you take a report, you take a blood sample report, and then you go for stopping the medication.
Thanks, Dr.
Okay.
एक क्वेश्चन और पूछना चाहता हूँ।
Hello.
Yes.
मेरी मदर जो है, जो पैंक्रियाटिक कैंसर है, वो शी इज नॉट इंटरेस्टेड इन टेकिंग द शिवाम्बू। अब उनको कैसे वो करें, या किसी हेल्दी पर्सन का शिवाम्बू क्या कैसे ट्राई करें?
नहीं, आप क्या कर सकते हैं, वी कैन हेल्प हर। हम उनको कन्विंस कर सकते हैं, आपसे बेहतर हम उनको कन्विंस कर सकते हैं, हम उनको बता सकते हैं सारी चीजें की, बिकॉज वी डील विद ऑल काइंड ऑफ पेशेंट्स, वी डील विद एवरी काइंड ऑफ पेशेंट्स एवरी डे. I have seen lot of patients who are not willing to take Shivambu, but मेरे कहने पे और मेरे पापा के कहने पे, मेरे अंकल के कहने पे उन्होंने शिवाम्बू लिया. They started enjoying that process of getting better. Okay, so starting में थोड़ी हिचकिचाहट रहती है, but once they start drinking, they'll have that effect in our body, healthy effect in our body, and then of course they'll start taking properly.
So I must bring the
Hello?
Anand Kunj.
Yes, you can bring to Anand Kunj, or you can contact on phone as well, no problem.
Okay.
But for treatment protocol, you should bring her to Anand.
Okay.
Hello, Sandesh.
Yes, Bola.
Sandesh.
Yes.
Friends, somebody has asked what are the fees at Anand Kunj for 10 days.
Yes.
Anand Kunj is giving a treatment like a ICU, intensive care unit. If you are admitted in the 5-star hotel or any hospital for getting a ICU treatment for 10 days, you can imagine what will be the cost. And here is a specialist. Every disease is being cured. So there are all specialists of all diseases in Anand Kunj.
Yes.
Only staying in Anand Kunj is a very happy street because the location is so beautiful and you will enjoy the climate. And for your
Yes.
information, present their fees. They don't call it a fees. It is your donation. They take only for normal patient, everybody, 18,500 only, and 20,500 for the special rooms. So you can compare your stay in hospital.
So many vitamin D deficiency.
And
Let me complete.
Welcome to Anand Kunj.
Yes, just like how Chavan sir told, our first starts by 16,500. General rooms, we start by 16,500. Right now, yesterday I went to a special hospital. There, one ICU unit, one day they charge 20,500. They charge 20,000 rupees for one day. And at Anand Kunj, we charge only 20,000 or 18,000 for 10 days. So there is a lot of gap, and we don't take that money for us. We try to develop this system more. We again reinvest in Anand Kunj. We reinvest in all our patients and everything. Okay, so it's kind of a trust that we run. Yes, thank you.
Okay, sir, I have one question.
Yes.
Is it helpful for depression patient?
Yes, it can help for sure.
You
Again,
yeah,
yes,
how it is?
yes. Again, I term depression as a first.
It's not a normal. It's a corona depression and all. It's a that depression only.
For sure, it will be helpful.
Okay.
Again, I'll tell you, as I told, the dopamine or serotonin secretions which happen in our body happens when there is proper amount of fat and proper amount of muscle mass in our body. Okay, so there is when the patient is obese or when the patient is having a lot of fat in their body, that is one of the reasons which leads the patient to depression. When we treat that patient properly, first on physical level plus mental level, when they properly practice yoga, when there is detoxification in your body, automatically that patient will come
But
out of depression.
sir, I do that only, but they are not doing because I can't do yoga. I don't want to do yoga. I don't want to go for meditation. Then what to do? Then you tell me
Then you
what
can
to do with it. Yeah, this is my
then
main
you
question
can,
actually.
yes, then you can send them to Anand Kunj. Of course, we have
Yeah.
treated a lot of depression patients. We have dealt with everything. So not just with Shivambu, but there is something called as yoga, meditation, and counseling. Counseling is also very effective in us, in for human beings.
But
Okay, so
what
when
we
we counsel,
converse to first, what we converse, because I converse so many times, Omkar,
yes,
yoga, everything, but
yes,
that patient is not
counseling is
conversing.
very
So what
important.
to do? What to tell?
Counseling is very important.
Okay.
Themselves they should have themselves they should have that will come out of that disease. Okay,
Okay.
when they have that will to come out of that disease, then only anything is going to affect them.
Okay. Thank you, sir.
Thank you. Anyone having question or anything?
Hello.
Yeah, santhesh, some questions in the chat, other questions are insomnia, then bipolar, then vitamin D deficiency.
Yes, that's what I told. Bipolar disorders, depression, everything is mental disorder. First, that patient should be willing to come out of that things, then only we can give a better effect for them. Yes, Shivambu has a very, very, very good effect on everything. But the first thing what I tell as a doctor to patient, that you should be ready to come out of that disease. You should be ready to cure. Shivambu, yes, it's going to affect you, but you should be willing to come out of the disease. There are some patients I saw, they want depression just because they get attention from their family. They stay depressed because they get some attention, they get some good quality of attention from their family or friends or anyone. Okay, so they stay at that comfort zone. You should get out of that comfort zone, and you should come out of that. If the patient should willingly come. It doesn't work like we are keeping them in a jail and we are giving some mental torture or anything. It doesn't happen in Anand Kunj or in Shivambu anywhere. The patient should be willingly coming to us. Then only we can help them for sure.
Excuse me, sir.
Yes.
Sir, I have 3 children aged 15 years, 10 years, and 8 years. How much
Yes.
Shivambu should be given to them in the morning, sir?
1 glass, 200 ml of Shivambu they can drink.
Only morning will be sufficient for them, sir?
Yes, morning will be sufficient. Give them 45 minutes after drinking first Shivambu, so that in that 45 minutes they will pass 2 to 3 times motion, and their day will be better. They will have better day, better physical abilities, better mental abilities, better learning, better grasping. Their concentration will increase for sure.
Sir, from how much minimum amount I should start, sir?
1 glass you start, 1 glass. If you drink water, 1 glass, 200 ml, you can start with that.
Okay, sir. And maximum, sir?
Maximum right now you can take 200 ml. Right now I drink 400 ml because I am that much huge, 6 feet. I can drink that much. So I drink 400 ml. I'll suggest you to go for 200 ml first.
Okay, sir. Thank you, sir.